I'm Elizabeth Brown, and this is my presentation on the effects of COVID-19 and mental health. In December 2019, Chinese health authorities identified an unknown respiratory virus in Wuhan, China. By January 2020, the World Health Organization had named the virus COVID-19. The Chinese Center for Disease Control began releasing information on how deadly the virus is. The CDC began running temperature checks at local airports in hope of identifying travelers who may have caught the virus. By February 2020, the global death toll had reached approximately 2,100 people. The virus began to travel through Asia and neighboring countries, including Taiwan, Japan, Pakistan, and even South Korea. Reports of the virus began to come in from France, Italy, Russia, and Greece. The United States prepared for the virus by adding additional beds in hospitals. However, President Trump declared the United States was ready. State of emergency started being declared across the streets. However, in February, Trump advised the U.S. Public to treat this like the flu. For my study, I decided to analyze 4 countries, the United States, China, India, and Finland, and to compare and contrast their responses to mental health needs during the global pandemic. The following is a breakdown of each country. As of 2021, the United States has a population of over 300 million people and a GDP per capita of 63,543. On January 20th, 2020, the first confirmed case of COVID-19 was identified in Washington state, while the CDC told Americans they expected more cases. This prompted a shelter-in-place orders to be issued across numerous states. And by April, the majority of states had some form of shelter-in-place or lockdown mandates. This required the American public to stay in their residences and only leave the home for things deemed essential, leaving many people to pick up new hobbies and find innovative ways to stay creative. However, as the lockdowns were extended, people started to feel the strain on their mental health in forms of anxiety and depression, and another health crisis began to emerge. Facing the unknown, reports of anxiety and depression continued to rise, leaving many to wonder if help was available. If we examine healthcare in the US, we can see that one report claims that out of 11 high income countries examined, the US ranks the worst, although we have spent the highest proportion of gross domestic product on healthcare. This ranking was based off of 5 themes that include access to care, the care process, administrative efficiency, equity, and healthcare outcomes. Those who stood apart in the study were the countries that offer universal coverage and remove cost barriers. So, what type of mental health resources do we have in the US? There's a National Suicide Prevention Lifeline. It's available 24 hours a day, 7 days a week across the US. Trained professionals are there to ask questions, keep you safe, listen, provide resources, and follow up with you. We also have the crisis text line. By texting home to 741-741, you can text with a trained professional at any time of the day. They can help you to cope with feelings of isolation, anxiety, stress about school, as well as offer help to frontline workers. Another resource offered in the U.S. is the National Alliance on Mental Illness. They offer helplines with local chapters across the United States and train professionals to help with mental health education, access to support groups, and online discussions, as well as resource libraries. Now let's look at the local level of San Diego. As California began to see scattered confirmed cases of COVID-19, Governor Newsom took action. On March 19th, 2020, the California governor issued a stay-at-home order. On June 18th, a face covering mandate was put into place. On July 6th, San Diego was placed on the state's new monitoring list. On July 13th, California issues a closure of indoor activities, and by November, a curfew had been put in place to prevent people from socializing in enclosed spaces. In doing this local research, I decided to take to Reddit San Diego and ask the following question. I'm currently a sociology student at Mesa, and I'm writing a paper about mental health and the resources, or lack thereof, during the height of COVID. I know that I struggled with my mental health due to isolation and my family being so far away. If you're willing to share a story, I would love to hear it. Tell me your age, preferred pronouns, and what your experience was. Did you have access to mental health support? Were you not able to find any? If you couldn't, what were the barriers? Did you instead turn to friends or family? Here are their responses. One user shared that they had to change their insurance twice when they lost their job. They were evicted due to the landlord selling the home. When they went to get mental health care, the waiting list was 4 months long through Sharp Healthcare. So they stuck with it and eventually found a program that is half an hour once a week, and it falls under stress management. Another user shared that although he felt a little depressed during the first few weeks of the pandemic, he eventually found himself being an ear for other people in his life. He connected with those who were facing domestic violence issues, nurses working on the front line, and even went so far as to deliver food to people who were unable to leave their homes to grocery shop. Although he tried to stay proactive during the pandemic, he admits that sometimes he finds himself crying at night thinking about the stories that have been shared with him. Although he admits he should probably seek mental health support, he instead wants to further himself from the population after going through this for 20 months. He just wants to live in solitude. Finally, the last person to share told me that before COVID, they already suffered from anxiety and depression, but it was manageable. After losing their job as well as their health insurance, they would sleep all day just to pass the time. After 4 months of unemployment, they went in the opposite direction and took on 2 to 4 jobs just to stay busy. But this also took a toll on them. The fear of not having any money during a pandemic outweighed the mental and physical tolls working so much put on them. After some urging from friends, they resigned from their multiple jobs and decided to take a mental health break, admitting that they should probably seek some form of counseling even though the cost is high, even with insurance. So, what type of mental escapes were offered during lockdown in San Diego? Places like the San Diego Zoo, USS Midway, San Diego Museum of Art, the San Diego Air and Space Museum, and the Old Globe all offered some form of virtual tours and webcams to help you feel like you're enjoying a day out of the house without leaving your home. For mental health resources in San Diego, the National Alliance on Mental Illness has a local chapter. Once again, they offer online services to help with mental health support. It should be noted that there's often a cost associated with these services. Another option in San Diego is the YMCA. They offer virtual therapy appointments that can be arranged via email to set up appointments with mental health counselors. The next country I looked at was China. With a population of over 1.3 billion people and a GDP per capita of 10,500, it is where the virus was first identified in December of 2019. In January of 2020, Chinese authorities identified the virus as novel coronavirus. And by January 23rd, 2020, 11 million Wuhan residents are put on a government lockdown. While doctors across the country try to share the findings, many are ordered silent by the government. However, by February, many provinces and districts in China go on into mandated lockdown. To look at mental health care in China, you must acknowledge the stigma that goes with it. Under the Mao era, it was common to hide mental health issues, but during the initial outbreak, 1/3 of Chinese residents expressed some form of depression or anxiety. Those who were highly affected were often medical and essential workers. Although COVID has changed China dramatically, one silver lining to come out of it is the acknowledgement that it's okay to discuss mental health issues more openly and honestly. However, something to look at the future is there is only 2.19 registered psychiatrists for every 100,000 residents, which brings me to healthcare coverage in China. Although the Commonwealth Fund claims there is universal coverage, this is not necessarily the case. With the economic boom over the last 3 decades, China has transformed from a poor farming nation into one of the world's largest economies, and the current health system in place cannot support the current population. What has happened is a healthcare system based on economics where the wealthy have top tier care and the rest of the population seek out care in overcrowded hospitals. This is because there is a lack of trust in the primary care system because it is widely known that those doctors are often underpaid and therefore viewed as less educated or helpful. So, what did China's Joint Prevention and Control Mechanism do about mental health during COVID 19? Well, first, they published a pamphlet about mental health and COVID. Then they began to offer online assessment tools to help a person decide what level of mental health care they may need. This online assessment put them on a certain level of a 4-tiered system. However, priority was given to those hospitalized with COVID as well as healthcare workers, leaving others who may need more assistance to fend for themselves. Now we move on to the country of India. With a population of 1.2 billion people and a GDP per capita of 1,900, India found itself as one of the highest reporting countries of COVID. On January 30th, 2020, the first COVID case was confirmed. Between January 31st, 31st and February 1st, the Indian government evacuated residents from China. On March 22nd, the Prime Minister asked for a voluntary 14-hour lockdown, but this did not seem to work. So on March 25th, a nationwide lockdown was imposed. Then in June, the country began to reopen, even though it was the fourth hardest country hit at the time. So, how is mental health perceived in India? Well, according to WHO, 1 in 5 residents report experiencing some form of depression in their lifetime. Even with numbers so high, 47% of the population indicate higher judgment against those perceived to have mental illness. This may be due to the fact there are approximately 5,000 psychiatrists and 2,000 clinical psychologists for its entire population. In fact, India's psychological care only accounts for 0.06% of their healthcare budget. This may explain why in 2020 there was a 1.1% rise in suicides compared to 2019. So, what kind of healthcare system does India have? Well, once again, like China, the Commonwealth Fund claims that there is universal healthcare when that is not the case. India's healthcare system was initially set up on a 3-tier system with primary care at the village level, secondary care in the small and urban areas, and a third in the major cities. This tiered system has been replaced by for profit top healthcare that has moved to the large cities, once again showing how wealthy have access to excellent care while the rest of the population suffers, including those who live in smaller cities and villages. So, with a large stigma attached to mental health, what solutions did India offer? The two programs put in place are the National Mental Health Program and the District Mental Health Program. They helped to launch Kiran, a toll free mental health hotline. But what studies are finding is that it's hard for people who are experiencing mental health issues to express what they're feeling because of the unknown language attached with the emotions, as well as there being a huge gap in resources for those who live in rural areas. The last country I looked at was Finland. With a population of over 5 million and a GDP per capita of 48,773, Finland is often viewed as a happy and healthy country. On January 29th, 2020, the first case of COVID was detected. By March, the Parliament of Finland announced the closure of schools in most government run facilities. However, by May, elementary and kindergarten students returned to school. Finland did not have recommended mask mandates for indoors until August. By late August, Finland launched its COVID tracing app, which reached 1 million users within 24 hours. So, where does Finland sit as far as mental health stigma? Well, the United Nations has named it the world's happiest country. With high suicide rates in the 80s and 90s, Finland's health authorities decided there needed to be a change in mental health care by bringing more awareness to talking about mental health without stigma. Finland launched the Suicide Prevention Plan aimed at reducing means to suicide, learning how to talk openly and honestly about mental health, and making at-risk groups more inclusive. Looking at Finland's healthcare system, it is run by the Ministry of Social Affairs and Health, and it's often been praised for its public health care offered to all residents. Each municipality is responsible for organizing and funding healthcare. In these municipalities, primary health care is offered, while more specialized care is often located in major cities. There is private healthcare in Finland. In fact, 1/4 of the healthcare system is privately owned. However, they sell their services to local municipalities. With public healthcare, Finland offers many options for mental health during COVID. A company called Cup Therapy offered online tech support, and it aimed to make mental health more visible. An app created by psychotherapists, they share uplifting and encouraging illustrations along with words of encouragement through text and social media. They also offer online workshops to express mental health therapy through art. Another popular resource is known as Miro Health, developed by scientists and engineers. They have different options to help you build your own program based on your needs. Through online programs, participants can reach therapists, psychiatrists, or peer support groups all online. The goal is to not only provide talk therapy, but to help change lifestyle practices. If Finland's employers are looking for options for their employees, they can turn to Anti. With no size limitation to what businesses can use it, Anti's aim is to help businesses give mental health access to employees who may be experiencing burnout or stress. They offer services designed by professionals to meet all needs. After my research, here are the conclusions I have come to. First and foremost, the stigma attached to needing mental health care must be disconnected. This can be done by community leaders and public health officials by maintaining privacy, correcting negative language used, using public figures to reach different populations, and making sure all communities are reached. Mental health should have been on the forefront of leaders and healthcare system agendas in all countries, not just during COVID, but during all times, because mental health is often overlooked care that is needed. After my research, I found the following actions helpful to the global community: offering virtual access, attempts to reduce stigma when talking about mental health, and many insurance companies waiving copays for mental health care. But there is a lot more that could and should be done. Bringing attention to the socioeconomic gaps that often stand in the way of people receiving help needs to be addressed. While there are so many options virtually, it leaves behind an estimated 37% of the population that does not have access to the internet, whether it's due to financial reasons or physical location. The constant connection between employment and health insurance should not exist. By offering true public or universal health care, as well as expansion of health services to rural and lower income areas, mental health treatment can reach those who need it most. Finally, we must acknowledge that disease experts, scientists, medical professionals, economists, and sociologists predicted a global pandemic. Knowing it was not an if, but a when, shows the breakdown in infrastructure and institutions that should have already been in place. Without addressing these issues, we will continue to see a pandemic within a pandemic, and many of the global population will continue to suffer in silence.